Should we be worried when a child passes a lot of loose stools? Understood? And child has vomiting and loose motions, when we should worry, when we should approach a doctor, how we have to manage this child at home as far as possible. It is not that difficult to manage a child who is having loose stools right at home. No need to panic. The few things to remember. First thing is a warning sign when we should visit a doctor. First thing is the child is passing out more than what the child is taking. Means passing too many loose stools more than what the child can eat or drink. Right? And the child is not passing urine once in 4 hours. Or the mouth has become completely dry. Or the child is crying but there are no tears from the eyes. And the child is not passing urine even once in 4 hours. The child is extremely dull and very irritable. These are the times, or the child is associated with high fever, or if there is any blood in stool. Any of these signs are present, we need to visit the doctor for further management. If nothing of these signs are present, only what we see is increased frequency of stool, and the child otherwise is active. What we have to do in these children, just manage them with electrol water. Electrol water sachets are available widely across. Always pick up a small sachet which can be mixed in 200 ml of water, and what we need to give is 1/4 glass every 30 minutes. If that is difficult, what we can do is every 10 minutes we can give 3 to 4 spoons and keep on giving it till the child becomes well hydrated and active. Or else for every loose stool we can give at least 1/4 to half a glass. If we give that, the child would be absolutely fine. We need not rush to a doctor, because what we have to do is replace whatever has been lost. Obviously, if the child is associated with high fever, there is a blood in stool, definitely indicates it's a bacterial infection. The doctor needs to evaluate and give medication accordingly. Otherwise, most common cause for these loose stools it can be an irritation to a food, or it can be because of a viral infection. In all these conditions, simple management with electrol water is good enough. Other than electrol water, what else can we give in a house for a child who is above 6 months of age? Normally we can give sago water, we can give a little bit of khichdi. If the child is 9 months and above, we can give idli as well. We can give them banana, we can give them coconut water. So these are all the foods which are preferable for a child other than electrol water safely in a condition of diarrhea. See, what happens in diarrhea is the absorptive capacity, means whatever food we eat has to be absorbed, right? And then the remaining food should come out in the stool. But what happens here, the absorptive capacity goes down. So because of the infection on the intestinal lining, there will be swelling in the stomach lining. So what happens whenever there is a swelling in the stomach and intestine, it doesn't absorb any food. So whatever food we give comes out. So we need to give those foods which can get absorbed to a certain extent. So we give these foods like sago water, khichdi, coconut water or electrol water. What happens is 30 to 40% of it gets absorbed. Remaining goes out, 60% goes out. But that 30-40% is enough for the child to be active. It takes 6 days for this repair mechanism to work. It is just like, you're getting injured, your skin gets debrided. It takes 6 days for the skin to heal. Similarly, when your intestine gets injured because of an infection or an irritation, it takes 6 days for that repair process to happen. During this repair, we need to give foods which are easy for the stomach to digest, rather than high sugar foods or milk. What happens when there is a severe loose motions, if you give milk to the child, what happens is 19 to 95% comes out, only 5% remains. And if you're giving any sugar water or sweets or things like that, it drags the water inside and goes out. The child further gets dehydrated. So the best way of management is to give usually gastro diet or soft diet, which is very easily digestible for the child. Child remains active. Within 6 days, the repair mechanism gets over. The child will be in a position to absorb all the foods and the child becomes better. So, my dear parents, don't worry if a child is having loose stools. Just follow the principles of hydration with electrol water. Follow all the soft diets which I have advised, and measure whether the child is passing urine once in 4 hours. The child is active through the day, and the child is accepting oral diet well. There is no fever, there is no blood in stool. Please stay put in house. You don't need to visit a pediatrician. But what is other important last part is the child might develop a severe rash in the anal area because of frequent loose stools. What I would advise is wash it, dab it and apply coconut oil on that area. That redness also will not appear. The child would remain active. Thank you.